what can Nebraska do to move forward as you work to improve your community's health? And what are these things that we call health disparities, and how did Menthol create it? And just to get to the root of this, we're going to wrap around an understanding about responsibility and about solutions to gain further insights into this. Okay, so back in 1906, W.E.B. Du Bois noted that social conditions, not genetics, impacted the health of Blacks, and it was causing racial disparities in mortality rates. Now, this was back in 1906, but in actuality, if you go back even further in history, over 2,000 years ago, healthcare physicians were recognized that conditions often cause disparities. So this is not a new thing. It was in 2010 that the federal government formally recognized that social conditions, specifically the social determinants of health, were responsible for racial disparities. So racial health disparities cost the United States $175 billion in lost life years and $135 billion in excess healthcare cost and untapped productivity. And structural racism, that really describes the way our systems are structured. And we'll talk about this so that you'll understand what I mean when we talk about this. And this leads to these disparities. Law is just a tool used to create these inequalities, and it does so by structuring systems in a racial discriminatory way. And so I'll give you a good example of that. Signage laws, making advertisements more visible in less affluent areas, and invisible in more affluent areas. It's kind of interesting when you drive through low income areas in any part of the United States, you can normally tell if you're in a low income area by the signage. Why is that the case? Okay, so kind of to level set, what I want you to think about is, we don't have a lot of time today to really delve into a deep understanding of history and culture and context and geography, but these are the things that you need when you really are sitting here talking about a topic to really fully understand the context of that topic. And so we're going to kind of touch a little bit of that, you just touch a little bit of that today. All right, so racism, focusing on individual acts of racism obscures the reality of racial inequality. That's the first thing I want to say. It's critical to understand that racism is systemic and it's not a singular event. Systemic racism is a state of being that was birthed in this stew of greed that turned people against each other so that they couldn't unify to see their common plight. If you want to read some interesting reading, read about Bacon's Rebellion and how the landowners were frightened as a result of Bacon's Rebellion. And what they did, they invented this concept of legalized racism. And that there was a change in our English language around about 1671, in which before then, you didn't really see the difference between Blacks or whites in terms of language. You didn't see that. So this is really interesting. So Bacon's Rebellion, we're not going to really talk about that that much right now. But so in the modern day, racism is entrenched in just about every facet of American life. And I can provide you tons of examples of this. It's a networking of interlocking systems that was created to keep power in the hands of one group of people who were in the elite and take it away from another group of people. And there was some separation that occurred between the two so that never the two shall meet. These systems and structures that make up our society became mutually reinforcing and equitable systems, impacting every facet of American life. That impact is felt not just in housing, employment, healthcare, education, and criminal justice, but in other areas as well. And research shows that people are constantly working to evaluate themselves and to others in domains such as attractiveness, wealth, intelligence, and success. And according to some studies, as much as 10% of our thoughts involve comparisons of one form or another. And if you don't believe me, all I got to say is Facebook, Instagram, and other forms of social media that we have today, and they're petri dishes to support this. Advertisement is especially powerful in influencing decisions. Okay, so what has kept people in this state of inequality? Okay, so slavery, yes. But after slavery, there was Jim Crow. And Jim Crow laws, these laws, they were segregational laws. They were codified by the law, and they kept people separate. Jim Crow ended in my lifetime. I like to think I'm a relatively young woman, not that old. And I'm not going to tell you how old I am, but I'm pretty young. But Jim Crow ended in my lifetime. So that gives you kind of like a context of what we're really talking about is the last 13% of when African Americans were really in the United States, in which there's been an opportunity to truly be equal. All right, so let's kind of go back again and let's talk a little bit about menthol. You know, menthol was it was discovered by accident. It has a very cooling sensation to it. When added to tobacco flavors, it allows people to breathe deeper. It's also found in starter cigarettes. Okay, let's see. The tobacco industry or big tobacco has used excessive target marketing to increase sales and profits. Actually, if you go into most African American homes, especially in the 60s, 70s, and 80s, you'd see, and 90s, you'd see 3 magazines, Essence, Jet, and Ebony. And in these 3 magazines, disproportionately, there were advertisements for menthol cigarettes. Big tobacco also, and as a matter of fact, Ebony was 10 times more likely than People to contain ads for menthol. Okay, so in the United States, Black people smoke at similar rates as white people, but have higher associate death rates from cancer. And there's several reasons for this. Racism, of course, is one, but also the vulnerability to tobacco advertisements. And menthol cigarettes have been heavily marketed to the Black community in the United States for the past 100 or so years. Menthol cigarettes have a minty flavor that makes it easier to start smoking and harder to quit. And internal documents from the tobacco industry shows that Black models and actors and Black athletes were used to spread these false lies in the community and also creating a false cultural affinity to the menthol product. So where you live actually dictates how long, where you live actually dictates how long you live. Low-income neighborhoods are, again, purposefully targeted by the tobacco industries. Low income, those with lower socioeconomic status who use tobacco suffer more from disease and have lower smoking cessation rates and poorer health outcomes. Okay. And so let's talk about like personal responsibility. This is the question that many people ask. So there was a 1987 JAMA article that explored the personal responsibility with regards to smoking. And within that article, they said, the argument that people freely choose to smoke assumes that individuals at the point of initiation of smoking, often which is in adolescence, hold accurate beliefs about smoking. Smoking beliefs and the presence of known smoking risk factors were assessed in interviews with a sample of 895 urban youth. The respondents greatly overestimated the prevalence of adult and peer smoking and had negative attitudes of their peers were greatly underestimated, and a large proportion believed that they were less likely than other people to contract a smoking-related illness if they became smokers. The misinformation was paramount, and it was because of misinformation that spread amongst people, especially the youth. They became a greater risk for smoking and are most often misunderstood the tobacco industry's argument with regards to the decision to smoke as it reflects to an informed choice. And they didn't understand that that is without merit. So there was a 2007 study that found that there were 2.6 more tobacco advertisements per person in the area where there's the African-American majority. Retail marketing makes up 95% of the tobacco industry's marketing expenditures. And that was in 2015. Well, in 2019, the tobacco companies spent $8.2 billion on advertising, $8.2 billion. And as you can see, Marlboro, which is the actual #1 brand in the United States, with Newport being #2, as you can see here, leading US brands worldwide in 2020 by brand value. You can see Marlboro is there. So I want to point this out. By saying individual choice, that's not true. 90% of people say that they made a purchase based upon an ad. And I want to just point out to us, how many of us, if you're searching for something, do we say we're going to a search engine, or do we say we're going to Google it? If you're going to make a copy, do you say you're going to copy something, or do you say you're going to Xerox it? So there's an estimated 375,000 tobacco retailers in the United States. That's about 27 times more McDonald's and 28 times more Starbucks. And they're disproportionately located in low-income communities. Low-income communities are bombarded with tobacco advertisements. So menthol, I want to point out that smoking has other health effects, other ill effects, other than just illness. Smoking is also one of the leading causes of residential fires, and also one of the leading causes of illnesses. Nearly 9 in 10 African-American smokers age 12 and older prefer menthol cigarettes. So, but after what I just talked about, do we really need to ask why menthol? And I do want to point out that the majority of people support a ban on menthol cigarettes. The tobacco industry wants you to believe otherwise, but that's not the case. Most people do. And actually that a ban on menthol could reduce smoking and vaping attributable deaths by totally over the next 40 years by almost 1 million people. So now what do you do? What can you do? Well, I want to urge you, number one, after our conversation, don't delay. I want you to go onto our website, and I want you to sign on to the FDA comment page. We're in an open FDA comment period. Please join the center in providing a robust and evidence-based comments to the FDA about the need to ban menthols. And you'll see that on our website if you just go there. And also, if you run into people, and if you hear misinformation, that you stop them and you say to them, you speak up and you speak out when you hear falsehoods. So I'm going to open the floor up now for questions. And
thank you, Sterling, for the presentation. I know I had a list of questions, but we're going to get started with the questions in the chat first. And I want to encourage everyone to type any questions you have into our chat. So the first question we got is, what about the economic impact as a disproportionate cost of smoking? And then in parentheses, they wrote, cigarettes are expensive.
Yes, cigarettes are expensive, and there is a disproportionate economic impact upon a family's pocketbook. You're absolutely correct about that. And but as a driver, getting people to stop smoking, getting people to, and especially in areas in which you're bombarded with tobacco advertisements, getting people to have an alternative way of handling stress and kind of changing their routine can save, like you said, could save families thousands of dollars, not just in the cost of cigarettes, but ultimately in lost productivity and lost years and healthcare dollars for the community.
Thank you. So we're talking about, we're talking specifically right now on the current effort to ban menthol. And my question to you, Sterling, is I know there was other flavors and there was a ban. So what did that look like in the past, and why wasn't menthol part of that process?
That's a good question. Why menthol wasn't a part of that initial ban? The initial flavors that were banned were things like bubblegum or apple or, flavors like that. Menthol wasn't banned, and I don't have a good reason for that. I don't know why. I suspect that I suspect it had something to do with the economics. Menthol is found in about 90% of all cigarettes, even cigarettes that are not labeled as menthol. So if you put a ban on menthol, that means that you wouldn't have a starter cigarette or a starter brand. So I suspect that was one of the chief reasons that the tobacco industry said that menthol was not included, because it would, that why the tobacco industry wanted to lobby for that. But it was racist. There's just not too many, not to include menthol in that, especially when 90% of African Americans are smoking menthol, costing 45,000 lives a year. So.
Another question we got in the chat is, what resources would you recommend we share with people and loved ones who seem to think this ban is some kind of conspiracy theory?
Oh, that's good. Yeah. If you go to the center's website, we have on our website a toolkit called 70%. And I would urge you to look at that, and I would urge you to share that. It gives a good history about menthol cigarettes, and it also gives you a good history gives you some facts, solid facts, so that you can actually tell your loved ones, no, that is not the case. So so it's 70%. For people who are actually working in tobacco control, we also have a publication, the Health Justice Guide in Tobacco Control. I would urge you to go get that, and that it's also available on our website. You could download that. It's really important, tobacco and tobacco use is an addiction, and people need compassion so that they can deal with their addiction. It's it's difficult for people to stop smoking. It's easier to start smoking. It's really, really hard to stop smoking. Actually, it's probably harder to stop smoking than anything else. And so one thing I would also encourage, in addition to educating yourself about it, but also direct your loved ones to the quit line, so that they can get the help that they need, and get the help that they need in a way that will support them through their journey.
Thank you. And I encourage our guests to continue typing in questions into the chat. One of the questions we have is, and you kind of, we've touched on it through the presentation and in conversation, but currently, what does the data show us in regards to the impact of tobacco on the Black community and other minoritized populations?
Okay, so disproportionately, African Americans suffer more from illness and disease. I'm sorry, same thing, more from illness and death from tobacco use than other populations. And some of that, there's questions as to why that's the case. Such as like when smoking the menthol, does smoking the menthol actually mean that you're breathing in deeper? And because of breathing in deeper, is that causing more illness at an earlier state, in an earlier time, that manifests itself actually earlier, so that when African Americans who are diagnosed later, actually in later stages for lung cancer than and often for other cancers, is there some correlation between that? So there's still studies that are being that is being examined, but I do want to point out that the guidelines for clinical actually for lung cancer screenings have actually been modified. It used to be a recommendation that for 20 years, if a person smoked for 20 years, that person would be recommended for screening for lung cancer. That's now been reduced. And I cannot remember off the top of my head what the screening time frame is, so please forgive me on that. If you want to know, I can let you know that. But this will also save thousands of lives, because like I said, African Americans, as we are diagnosed with lung disease, we're often diagnosed later, and later with the morbidity, when we're sicker than often leading to death, higher rates of death. So I'm hoping I'm answering your question.
Yes, thank you. Something that I was having a conversation with someone about tobacco, and they were like, well, tobacco is a plant. So could you share a little bit more of like how that plant became commercialized in the history?
Yeah. So tobacco is a plant. Tobacco was actually grown in South America. It was grown about 8,000 years ago. They've actually found tobacco plants with people in ceremonial like settings. And it was used by the initial indigenous populations as part, and not all Native Americans use tobacco. That's very important for me to say, but many Native Americans did use tobacco, and it was used for spiritual and ceremonial purposes. So it wasn't something that was meant to be smoked like a pack a day. It wasn't meant for that. And so what initially happened for thousands of years, tobacco was used in this way. Now, there was I find this fascinating that, because I'm always telling my kids, when my children were younger, I would tell them, if somebody jumped off a bridge, are you going to follow them? Well, the peer pressure actually brought and took the tobacco plant, which was used for ceremonial purposes. It actually took that plant to Europe, Sir Walter Raleigh. I live outside of Raleigh, North Carolina. And so Raleigh, North Carolina is named after him. He was really big in the Elizabethan court. And he took tobacco, put it in a little pouch, and he would carry it around with him, and people saw it. And he smoked it on a regular basis. He got hooked. People in the court got hooked, and people started wanting more. And you know, this addiction actually fueled tobacco growth in the colonies, which led to, believe it or not, supported the slave trade, which entered in a host of all other types of evil. So a plant that was not meant to be used got co-opted and used in a way that has resulted in over 500,000 deaths a year. I won't understand that.
Thank you for sharing that, Sterling. So we had a question about resources to share with family members who think that the ban is a conspiracy theory, and we had some conversation in the chat about that. So I wanted to open the floor to Desiree if you wanted to share more of your experience with what you're hearing from your loved ones, and then we can continue to have conversation around that.
Oh, yeah. Oh, okay. Oh, okay. I'm reading what she's saying, that some older relatives who believe that the government is taking their way, a way of coping from the Black community. Um, yeah. Well, you know, again, smoking is an addiction, and understanding that and coming from a place of compassion is really important. And for people who see it as the government's way of taking away a product, the best way of reframing it is actually the government giving the gift of life. Ending menthol cigarettes, like I said, will save lives. There is no doubt that smoking causes cancer. And without smoking, there will be fewer incidents of cancer. And we're not just talking lung cancer, you know, you're talking prostate cancer, you're talking colorectal cancer. There's all types of other cancers that smoking causes. And that bladder cancer, for example. So it's really important that, you know, you have these conversations with your loved ones from a place of understanding and encouragement, and a place in which you're saying that this ban will save lives and will give people back their will give families and communities back lost years. Yeah, that's I'd approach it from that very loving and supported space.
The next question we got in the chat was, what types of messaging and tactics are you seeing from the tobacco industry? What messaging and tactics are you seeing in their opposition for the ban?
Well, you know, it's very similar to what Desiree was saying. You know, we're seeing that. We're seeing also the fact that the enforcement will cause an increase in African Americans being arrested, or we're seeing that there'll be more police, more police involvement within the African American communities, because menthol is a product used by African Americans. And these are lies. And the fact of the matter is, the menthol ban is a ban on manufacturing. That is very important. There won't be a product. It's a ban on manufacturing. It is not a ban on possession. And that's really important. So, you've got people out there who are actually funded by the tobacco industry spreading these lies, and are saying, hey, I don't get it. I don't get that. So it's really important that, again, when you're confronted with these issues, that you say, look, it's a ban on manufacturing. It is not a ban on possession. That's very important. Enforcement is about enforcement on a manufacturer. That's important.
Thank you, Sterling. We also had a comment in the chat that shared, I'll never understand the it's a plant argument. Poison ivy is a plant, opium is a plant, but more than 75% of plants on earth are not safe for human consumption. And I wanted to add my perspective, and then I wanted to hear yours. I think for me, in that comment, right, it's a plant, like there are plants and some are safe and some aren't safe for human consumption. And it's important to understand, for me, the history of how they become commercialized and marketed for certain purposes.
Yes, and also we're not talking about smoking a tobacco plant. What we're talking about are smoking a product in which 7,000 chemicals are added to the product. I mean, you got formaldehyde in it, you've got arsenic, you've got all kind of nasty chemicals that have been added to this product, including increased nicotine. And so you aren't smoking a plant, you're smoking something that has been altered and is a disease, and is something that has actually been made to be even more addictive than so it's not a natural substance. And what kills me is that the tobacco company, you want to talk about advertisement, if you look in the African American community, yes, menthol is menthol's heavily advertised in the African American community. In Native American communities, you're heavily advertising spirits, cigarettes, or these other brands that are like supposedly natural cigarettes, in which, again, things have been altered and all these additives in it, and it's killing people. And so no, it isn't a plant. It's not a plant. It's something that's been packaged, lots of 7,000 chemicals in there. And we wouldn't ever do it. We wouldn't put your mouth on the back of an exhaust of a dirty diesel car. I mean, that's what people are doing when they're smoking. Yes, ammonia. Yes, Cynthia just wrote down. Yeah, ammonia is a chemical that's added in there. There's over 7,000 chemicals that are in tobacco products, and these are chemicals that harm our bodies and cause death and disease, and and addiction, and that's important. They cause addiction. Menthol being one of the chemicals to help people to breathe it in deeper and to get people addicted to the product.
The next question we have in the chat is, has the increase in vaping changed the trajectory of menthol cigarette use in the Black community?
No. African Americans primarily smoke still menthol cigarettes. If with the vaping adding, vaping into that mix. Also, little cigars. African Americans also smoke little cigars like Black and Milds. So no, e-cigarettes, the trajectory has not changed. Many people have used the excuse that e-cigarettes are something that people can use to stop smoking, but what often ends up is that people end up smoking an e-cigarette and then smoking their regular cigarettes on top of that. And I know many of you know that with these cigarettes you have cartridges and cartridges of different sizes, and you can smoke a cartridge that's has as much nicotine in it as a whole pack of cigarettes. So it could even be more addictive. So yeah, no, e-cigarettes are they're harmful, and more studies need to be done as to the long-term effects, as to the health effects of the horrible health effects that they'll have on our bodies. Yeah.
Okay, so we talked, and you covered in your presentation a little bit about the history and then the data that demonstrates the disproportionate impact. The next question I have is looking at, we're looking at data and we're looking at industry documents and different like laws that have been embedded into this system.
Yes.
My question is, why must tobacco prevention be anti-racist?
Mm. Well, actually, everything should be anti-racist. Racism is something that has permeated American life, and it's you can find it everywhere. As a matter of fact, here I'll give you a couple of some figures. Media research shows that the media actually depicts African Americans overwhelmingly as poor, relying on welfare, from dysfunctional families, having absentee fathers, or as criminals, despite what the actual data shows. African American families are represented 2/3 of the time as being poor in the media, but in reality, African American families account for less than 1/3 of Americans in poverty. White families, which represent 17% of the poor, portrayed in the media. In reality, whites actually make up 2/3 of Americans in poverty. For example, here's another one in school funding. For every student enrolled, the average non-white student receives $2,226 less than the average white school district. I can go on and on about the differences in how racism shows up in our everyday life. I'll give you one, and this one actually impacted me and my family. We went and we had our house assessed, and the first time we had our house assessed, my husband was home, and my husband's white, and he was home, and he got an assessment, and the house assessed at the rate in which it actually is. The next time, within 9 months, we got our house again reappraised, and I was home, and he appraised the house at $40,000 less. And we had added more money into it, and houses in the neighborhood had increased. Yeah. This is something that commonly happens. And actually, yeah, well, and we knew. And so, we knew the person who we worked with, with the mortgage broker, and everything worked out fine in the end. But my husband and I, we joke about that. And I tell him, I'm saying, okay, so when things like this happens, you have to go out front and use your white privilege. And he laughs and jokes, but that's part of it. And actually, it's very painful, although yeah, I think it is funny, and he laughs at it too. But so these things happen, and the differences in mortgages now. Wells Fargo was just fined $175 million in 2012. It's still going on today. And so why do I or should tobacco prevention be anti-racist? Absolutely. Everything needs to be anti-racist. People need to be judged as who they are, not by, they need to be judged by who they are.
Thank you, Sterling, for sharing that. The next question we have is, what can our communities do to spread the word about the link between racism and smoking, especially of menthol cigarettes? And a follow-up question is, in addition to policy changed with the FDA, what kind of community prevention activities do you recommend?
Well, a couple of things. One, I would recommend that download that health justice guide, read it, um, spread the word, share it with as many people as you can. Have talks like this. I think that's really a good thing. Um, um, work in school systems to get kids not to smoke in the first place. Actually get them to lead, get the youth to lead the prevention efforts. I'm telling you, nothing's more powerful than youth leading their own efforts, and they're wonderful at it. Um, I, I would also encourage you to work with if you already don't have this in place, and many places now do, but work to make sure that smoking is a vital sign, and that's asked in your healthcare systems, in your doctor's office, like at your Epic, making sure that when people go, that the doctor's asking that question, do you smoke? That often prompts people to call the quit line. Make sure that quit line numbers everywhere, and work to get additional quit line funding so that people can have NRTs available, or nicotine replacement therapy, so that people can get help to stop smoking. Um, and let me think, what else do I think you can do? Yeah, when you hear people start talking about and spreading the lies about how a menthol ban is going to cause additional harm in the African American community, just point out that a menthol ban will save 45,000 African American lives every year, and that menthol ban does not, and that enforcement is not on the person who has it. Enforcement is on the manufacturer. Make sure that people understand that. That's very, very important.
Our next question is, I've heard from an AA smoker, smoking is less harmful to me than alcohol or drugs. I need some pleasure in life and can't afford expensive vacations. Addiction from one to addiction to another. Do you find that Blacks caught in nicotine addiction attend or avoid groups like AA or anti-addiction programs and healthcare support groups?
I cannot answer that question. I don't know. I don't know. It depends in many areas where you are, if you even have access to addiction support groups, whether if you even have access to programs like AA, or even Quitline. It varies from state to state. What I would encourage you to do, again, is to be very, very, and I say this because it's so important to understand that tobacco use is an addiction. And it's funny how you get so used to, especially if you're using a product for 20, 30, 40 years, you get so used to this. When you are with your friends, you do this. When you come home, you do this. After you eat, you do this. You get into this habit, and that smoking actually supports that and gets actually embedded in your brain. So when someone right before they go to bed, they light up. Right when they wake up in the morning, they light up. And this becomes part of their routine. And what we're asking people to do when they stop smoking, we're asking them to break their routine. And it's hard. I mean, it's hard for people, if you're a non-smoker, to do something different. It's hard for you to do this if you're a smoker. Again, I'm just saying to be very sympathetic and empathetic with that person, and to support them in their quit journey, but get them to stop smoking. And a lot of what I've talked about is with African Americans, but it's all Americans are suffering from tobacco use, and all Americans get cancer and from the use of cigarettes, and not just cancer, but other debilitating illnesses from the use of tobacco illnesses. So again, I would encourage support, and encourage if you're not able to find some resources in your area, look online. There are resources online.
Thank you. We have time for one or two more questions if you would like to enter them into the chat. And Sterling, it's been really great having this conversation. I did kind of use this as an opportunity to talk to Sterling more, and we have just been talking about how things, for me, like my grandfather died from lung cancer when I was very young, and at that age I thought like he's choosing to do this, and it took me a lot of learning and listening to experts like Sterling to understand the systemic and racist practices that have been put into place to target our communities, and the importance of having an anti-racist lens when we approach tobacco prevention. Also, if you feel comfortable, you can feel free to unmute yourself and ask a question directly if you would like.
This is Aljamal. Can you hear me?
Yes.
Okay. Sterling, my question is, in Nebraska particularly, we always like to compare ourselves to other states, and I assume you've interacted with other states or other programs. Are there any beacons or states or programs or counties that are really good in this anti-tobacco process that you're working on? Is there some great models that we can emulate or copy or beg, borrow, and steal from your vantage point to notch up our game here in Douglas County or in Nebraska?
There's lots of good things that are actually happening. There's some good programs, actually, believe it or not, in Detroit, Michigan. Detroit, Michigan has a good program. Grand Rapids, Michigan actually has an excellent program. Wisconsin, there's a program out of Wisconsin. Lorraine Latham is the executive director there. She's doing a fabulous job. And actually, she is getting retailers not to sell menthol. Think about that. It's good programming that's happening there. We've got a burgeoning program in South Carolina, actually, in the Charleston area of South Carolina, that is working and having policy wins and successes in the state. So yes, there are several, and actually I'm going to several states programs that you can actually emulate, and several local coalitions that you can actually emulate.
Thank you.
Thank you. We have time for one more question if someone would like to unmute themselves and ask Sterling a question. If there is none, we'll go ahead and close out. I want to thank you, Sterling, for taking the time to have this chat with us. And I wanted to share that this event is co-hosted by MORE, which is the Movement in Omaha for Racial Equity. And you can learn more about us on our website. And it's co-hosted with MOTAC, which is a local coalition, which is called the Metro Omaha Tobacco Action Coalition. And they work to reduce the health and economic impact of tobacco use in the Omaha metro area. So if you're interested in engaging more in tobacco prevention and menthol, feel free to check them out as well. We did drop a evaluation into the chat if you could give us feedback on how to strengthen our programming. But I want to close out with any closing thoughts that you would like to leave us with, Sterling.
I think the only thing is that, I'd like for us all to remember that we're all in this together. What impacts one group impacts the other. We don't get through this life, like in our little silos. It just doesn't happen. And that working together, we can accomplish great things, including working with tobacco prevention and control. So I'd like to end it at that, is that just to remind everybody that, working together and recognizing that we're in this together, in this fight together, is very powerful. And and approach the work from that perspective. And thank you very much for having me. Yes, thank you. Thank you.